Good afternoon, everyone. Welcome to the White House. Want to start by extending our greetings, my greetings from the President, from the First Lady, and the entire team here at the White House, and thank all of you here in the audience today, an incredible collection of activists, of members of support teams, of research organizations, and others, and our incredible champions of change who are here today to thank you for the work that you have been doing and the work you will be doing this entire next month and on in the future. I want to say just a little bit about what the idea is of Champions of Change that we've been doing here at the White House and our ask, I think, of all of the champions we're honoring here today. One thing that the Obama administration understands at its core is that while we are here in Washington having the policy debates that you see endlessly recycled on cable TV, one thing we understand is that real change in this country and the kind of work that all of you have been doing only happens one community activist at a time, one champion of change at a time, and that as we all try to tackle issues like breast cancer and every other issue that we all deal with as a country, that folks like our champions of change here are who make real change happen and make people's lives better every day. So what we want to do, what we do every week, is shine a spotlight on great work that's happening at the community level, happening at the network level, happening at the organization level, and would ask all of you who are in the audience and our champions here to use this spotlight that we've shined on you to tell your story. What we've seen week after week is that as people across the country see what a difference one community member can make in a broader circle, that they're inspired to action as well. And we would ask each of you to tell your story, to talk about being a champion of change, and I think together we'll be able to expand this network that is tackling breast cancer and moving this country forward. I think it goes without saying that we all wish there was no need to be here today to talk about this issue. And I think it goes without saying that this is something the Obama administration is committed to. The focus that we've had on healthcare issues writ large, and breast cancer particular, is something that we're very proud of. But as I said, we know that the work that all of our champions here are doing are an absolute integral part of all of this, and we view ourselves as partners with all of you leading the way. So I want to thank everyone here in the audience. I'm very much looking forward to the discussion that we're going to have today, sharing of best practices, sharing of ideas. I do ask each and every one of you to help us shine a spotlight on these champions of change. Let their stories be told, the stories of the difference that they're able to make in their community. And one story that I'd like to briefly share with you about the difference one person can make is about the next person that I'm going to ask to come up here, the person who's responsible for all of you being here today. Shira Sternberg is someone I've known for the last 5 years. I've worked with her on a number of different jobs. I've seen the energy that she brings to an issue. I've seen the passion and her ability to get things done and her ability to bring people together. This is an issue. Breast cancer is something that's touched Shira in her own life, and I have seen the passion that she brought to bringing everyone together today, and ask all of you to join me in welcoming Shira to the stage.
Thank you. Thanks, John, and thank you, everyone, for coming today. I'm honored to be with all of the champions here, both on the stage and in the audience. My name, as John said, is Shira Sternberg, and I work for President Obama just 4 blocks down the road at the Environmental Protection Agency, protecting people's health and the environment and trying to keep our homes and workplaces free from carcinogenic chemicals. I started working for President Obama as an organizer in Iowa in 2007. Organizing is a skill I picked up from my late mother, Pat Barr, who brought me along with her when I was 10 years old back in the early 90s. We trekked all over my little town of Bennington, Vermont, collecting petitions for the National Breast Cancer Coalition's 300 Million More campaign for breast cancer research funding. My mother was diagnosed with breast cancer when I was 4, and my little sister was just 9 months old. Shortly after, along with some of the women in the room today, she helped found the National Breast Cancer Coalition. My mother's cancer first metastasized when I was 6, and when I was 13, it spread to the lining of her lung. From that point on, she had regular reoccurrences in her bones, her brain, her eye, again in her lung, and finally in her liver. She passed away from liver failure when I was 20 years old. My grandmother, who was one of the women who helped play the role of mother for my sister and I when my mom was too sick to do so, also died this past August of metastatic breast cancer. It is likely only a matter of time before my sister or I are diagnosed with breast cancer, and there is not a screening, a test, or a treatment to prevent that from happening, or the suffering that goes along with it. The same is true for over 230,000 women that will be diagnosed this year. We are here today because my story is not unique. I know all of you have similar stories. We're here today because we believe that with hard work, persistence, education, and organizing, we can end this disease for the millions of families that are affected by it every day and the millions more who can be protected from it in the future when we end it. So I thank you from the bottom of my heart for the tireless work you do. Let's pause for a moment for our friends and family that have already passed away and the 110 women that will die of breast cancer today. Thank you. Okay. Now we'll move into the discussion so we can talk about how we're going to solve this problem. And we'll start by having each of the champions just say a little bit about themselves, and then we'll begin the discussion. Oh, Kyle's going to bring the mic.
And you guys can come up.
Thank you. Thank you very much. Good afternoon. My name is Elise Gellerman, and I am the affiliate representative to the National Board of Susan G. Komen for the Cure. I'm honored to be here today, and I certainly share this honor with all of you and all of the women who are fighting this battle. I've been a volunteer with Komen for about 11 years, and I started because as a co-survivor, I watched too many of my friends and coworkers fight this disease, many of them successfully. I'm happy to say some of them not very successfully. So I'm a passionate volunteer in the Denver, Colorado area, the Denver Metropolitan Affiliate. I worked in public policy because I believe that is certainly part of the solution. And I think it's important that, that we advocate in our communities as well as here in Washington. In my professional line of work, I'm a healthcare consultant to hospitals. So I take my passion into my work to make sure that services are provided for women, that they're provided effectively and efficiently, and that women have the resources and the treatment and coordinated care that they need to fight this disease. Thank you.
Hi, my name is Robin Prothro, and I am the Executive Director of Komen, Maryland, with Susan G. Komen for the Cure. I have been the Executive Director with Komen, Maryland for 12 years, and before that I was involved in women's health. My background is, I have a bachelor's from the University of Maryland in nursing, and then I went to Hopkins to the School of Public Health. And so I've been involved with policy and advocacy and community health, basically for my career. It has been a wonderful opportunity to be involved with Susan G. Komen. And just to tell one of our big stories, one of the things that we've been able to do in the community at the grassroots level and in the educational system is start a program at the University of Maryland School of Nursing for adding curriculum specific to breast cancer into the curriculum, which was, believe it or not, there was no school of nursing in the United States that had curriculum specific to breast cancer. So we have now spread that curriculum to every state university that has a nursing school in the state of Maryland, as well as the curriculum has been accepted by the School of Social Work, the School of Pharmacy. The School of Medicine is reviewing the curriculum now to see what's appropriate for the medical curriculum. And it is being reviewed and accepted by schools across the country. But even more exciting than that, in terms of our sort of global outreach and awareness for women across the world, the program, which is on web modules, so it's very easily accessed, has been taken into and used by 26 international schools of nursing across the world to increase people's awareness, understanding about breast self-exams, and also other kinds of technology for early diagnosis and treatment in communities that are far-reaching. And Komen, Maryland is thrilled to have brought this program to all of those women. And I'm honored to be here today, and I acknowledge all of the work that all of you all have done in your communities too. Thank you.
I'm Ann Partridge, and I'm a medical oncologist at Dana-Farber Cancer Institute in Boston and Harvard Medical School. I initially started out doing work in breast cancer, caring for women doing clinical research, and saw far too many young women, such as women like Shira's mother, as you just heard described, coming in and dealing with the breast cancer at a very young age, and all of that entails from both a physical and emotional standpoint. And that compelled me, along with a colleague, to create a program for young women with breast cancer at our institution, which now 6 years later has served hundreds of women, both in our institution and thousands more beyond with our educational programs. We have now recently been granted through Susan G. Komen for the Cure, who nominated me for this honor, to develop and implement a program that is a virtual young women's program so that we can bring our comprehensive care as best we can through the web and print materials to women who are not as fortunate as to be able to be in a very resource-intensive place in a high-intensity city, so we can get better care out to women who may not be able to access it on their own. So we're working very hard at that, and I've had the honor through Susan G. Komen for the Cure to be able to develop that even further and to be here with all of you today. So thank you very much.
Hi, I'm Joyce Simha. I am a 17-year breast cancer survivor diagnosed at the age of 26, and one of the co-founders of the Young Survival Coalition, which is a board member organization of the National Breast Cancer Coalition. And I am extremely passionate about ending this disease and finding a true, we have a true strategy in how to end the disease. And so that's very important. And I'm going to keep it brief, as Shira asked me to.
Thank you. My name is Pat Haugen, and I'm a 14-year survivor of inflammatory breast cancer. And I come from Sioux Falls, South Dakota. I come from a family, my grandmother died of metastatic breast cancer, as did my mother. So I feel my role in my community is really the world of all women who have faced this disease, all women who may face it, and those families who may be touched by it. So I view that as all of us. And my role in advocacy, I found where I fit best is in the research environment, where I try to make certain that the voice of women and those patients who may face diagnosis or treatment become prominent in the types of research we get done, the evidence we have that the research is going to make a difference, and the accountability for outcomes within that research. And I'll pass it to Amy.
Thank you, Pat. Good afternoon. My name is Amy Bonoff. I'm with the National Breast Cancer Coalition. I'm a 14-year survivor like Pat. And I have devoted myself to advocacy, particularly in quality care and research. So I'm going to talk a little bit because I'm now a member of the effective stakeholder group for AHRQ, the Agency for Research Quality. And what I really find interesting is that we are trying to educate all consumers so they can make informed decisions. And we're working right now on trying to figure out what are the best aids so that we can make sure that everybody can evaluate evidence and make a decision along with their clinician, and realize that not everything is absolute and there's a lot of uncertainty. In fact, there's more uncertainty than certainty in this world. And we're trying to help education and also evidence, the evidence that is so important and that President Obama has certainly backed in the effective health care and in the affordable health care, as well as the CER, comparative effectiveness. Thank you.
My name is Wanda Lucas. I'm from Washington, D.C. I'm a 5-year breast cancer survivor and an advocate for the National Breast Cancer Coalition. I've had the honor and privilege to work with women in underserved communities, and I take on that role to be that voice for them, to make sure that the work that we do to end breast cancer does not forget about them, because the disparities and the high mortality rate among especially African American women is alarming to me. So I took my passion and I made it a full-time job, and through the National Breast Cancer Coalition, I'm working with them because we need to end this deadly disease. Thank you.
Good afternoon. My name is Shirley Mertz. I have been living with metastatic breast cancer for 8 years. I was diagnosed in 1991 with early stage breast cancer, and I thought after 12 years I had beat it, but it came back. When I realized what I had, I decided to become a research and political activist on behalf of metastatic breast cancer patients. So I began by joining the National Breast Cancer Coalition, which graciously nominated me for this honor. And I became informed about the biology of breast cancer and how to become a political activist. I was very involved in supporting the Affordable Care Act, which is very important to cancer patients in order that they might access quality care, affordable care, and accessible care. I try to get people involved in being a voice for themselves through my board membership with the Metastatic Breast Cancer Network, and I do research advocacy with the Translational Breast Cancer Research Consortium, which has 16 breast cancer centers. I speak in that as a patient advocate on behalf of metastatic patients, and I'm on a SPOR with the University of Chicago. If I could just add one more thing, I am so proud to be part of the National Breast Cancer Coalition. As a field coordinator in Illinois, we are trying to get the word out that the only way to end breast cancer is to find out what causes metastasis. Any woman who gets a diagnosis of breast cancer is not cured until she dies of something else. And researchers do not know why some people like myself who had early stage go on to develop metastasis. So as part of the Metastasis Summit, the National Breast Cancer Coalition is devoting resources to focus on a deadline, Breast Cancer Deadline 2020, to find out the causes of metastasis. And I believe that maybe I will be here for 2020, maybe I will not. But I know that what I'm contributing to that organization, as well as to my other areas of research, will make a difference. And Shira, I have to give you a hug a little later.
Good afternoon. My name is Amelie Ramirez, and I'm the director of the Institute for Health Promotion Research at the University of Texas Health Science Center in San Antonio, and also the associate director for cancer health disparities at the Cancer Therapy Research Center in San Antonio. In the last 20 years, I've been fighting to reduce disparities among Hispanic women. The area that I serve is a 38-county area in South Texas. 67% of the population is Hispanic. And one of the things that has not changed as hard as we're working, that still, when you say breast cancer, it creates a fear in women in being diagnosed with that. So our work is in the area of health communications research, health behavioral research, to encourage women to be more proactive about their health, to come in for screening. And if they're screened, we want to make sure that they have the best access to comprehensive care, from treatment through survivorship. And it's through Susan G. Komen for the Cure, who nominated me today, but it's also through their advocacy and their work that we've been able to make this work possible. They're also very committed to reducing cancer disparities for all women throughout the United States. Thank you.
I'm Ellen Stevenson, and I am a passionate advocate with the American Cancer Society's Cancer Action Network. I was diagnosed in 2003 with very aggressive breast cancer. I am still in treatment. but I am emphasizing that I am living with breast cancer. I serve at a state level in all advocacy functions. I conduct statewide advocacy campaigns. I made a decision when I was first diagnosed that I would live my disease out loud, that I would do everything I could within my power to educate, to advocate, and to raise significant funds to find a cure for this disease. My disease, thanks to research, is now in a chronic condition, but treatment is no longer possible for me. So I am living now with cancer in my lungs. Again, the emphasis on living. However, I am waiting for the next breakthrough so that I can continue treatment. I've already made the decision that whether or not my life continues, if that breakthrough is not found, I will continue to walk the halls of Congress, and I will do everything I can to make sure that we influence Congress to use their voice, use their vote, to bring cancer into the history books. One day I pray that I'll be walking the halls thanking Congress for having turned my chronic condition into a cured condition. Thank you.
Hi, my name is Ann Creech, and I'm from Toledo, Ohio. I'm a 3-time cancer survivor. I had breast cancer 30 years ago, and then I had colorectal cancer 10 years ago, and then I was diagnosed with metastatic breast cancer again a year ago. I'm going to say first and foremost, I'm a mom and I'm a grandma. So I come from an arena that I feel is very important too, because I do not want my kids and my kidlets to have the same legacy that I have right now. I am the first one in my family history to have had cancer of any kind. My sister did get cancer after I did. My brother has now been diagnosed with lung stage 3 cancer. I am with the American Cancer Society Cancer Action Network and have been working with them for about 6 or 7 years. I do all the things that Ellen is looking for too. We want a cure for this. We want people to step outside of their boxes, please, and realize the importance of this disease, because you don't live with this disease each day. You live with this disease the rest of your life. So the most important thing to me is I have watched so many of my friends and other people around my area die of this disease. And I feel very fortunate that for some reason I am still here and I have a voice to say something. I want people to have hope. I also want them to have the strength to pull their courage through their fear, because fear is the very first feeling that we have is fear. And you have to move for that, and you have to go for the courage, because beyond that, the courage is what pulls us through. And through the American Cancer Society Cancer Action Network, we fight for those research dollars. We fight for the prevention, which helped me. I was able to take advantage of the BCC program this last year. I had no insurance. I had an employer that asked me to get off my insurance, and like a fool, I said yes, having no idea what I was going to be walking into. So I went with no insurance. Well, I went with insurance, but it didn't cover anything but my copay for almost 6 years. So I called and canceled that insurance the day I was biopsied with this last one. And so that's my story as far as that part goes. But I'm there for the hope, the courage. I want to give some of my positiveness and some of my life to the people that are facing death. I want them to keep looking at life, and I want them to be peace, and I want them to fight hard. Thank you.
I'm Anne Marie Murphy, and I'm the Executive Director of the Metropolitan Chicago Breast Cancer Task Force. And I have a mother who's had breast cancer, and actually 7 relatives in the next generation and the generation before that with breast cancer. I'm also the mother of a biracial daughter, and the project that we work on, in the last 20 years, it may not be a comfort to those who have relatives who have died, but a lot of good things have actually happened in breast cancer. The death rate has come down a lot. We do have better treatments, more targeted treatments. We have better imaging. But for some, that promise has not been shared. In the city that I live in Chicago, over the last 20 years, there has been no decrease at all in the death rate for African American women. None. It's really shocking that we could live in a country that has so much abundance of healthcare resources, but they are distributed very unevenly and people access them very inequitably. Therefore, our organization, the task force, we are trying to improve the quality of care for all women. We're the first federally designated patient safety organization dedicated exclusively to breast health and eliminating racial health disparities in breast cancer. We're collecting quality data from all across the metro area, trying to work to improve care for all women. When we started our research, many of our researchers showed that African American women were less likely to access digital mammography, less likely to have their mammograms read by breast imaging specialists, less likely to get their treatment in a College of Surgeons approved treatment center. All the different factors that go with better outcomes were not shared equally. And so we're working to change that so that every woman can have an equal chance at life. And we really advocate strongly for funding for the breast and cervical cancer program nationwide. In Illinois, it only funds 13% of eligible uninsured women, so 87% are left behind. We're also advocating for better access and higher quality care in the Medicaid program. With healthcare reform coming, a lot more people will be covered by Medicaid, and if your Medicaid card doesn't buy you good health care, then the card is not worth much. So we want to make that card mean everything for everyone that relies on it. Thank you.
My name is Delia Oliveri. I'm from Las Vegas, Nevada, and I want to say how honored I am to be here today. I started volunteering for the American Cancer Society 40 years ago, 13 years before I knew that I would hear the words, "You have cancer." I was diagnosed with breast cancer in 1983. It was very difficult to diagnose because when they found out I had it on the film, the spot was no bigger than the head of a straight pin. And they were able to find it due to comparing a baseline mammogram that I had had 2 years prior. As a divorced single woman living alone, I was extremely devastated as I had to have a mastectomy because 28 years ago, that was a treatment of choice. Lumpectomies were very new. The survival rate was only about 5 years. So I opted to have that done. I found myself $40,000 in debt because I had just changed jobs. I was a legal secretary, but I had very little insurance, and I didn't work for 3 months. My first ray of hope came when a Reach to Recovery volunteer from the American Cancer Society came to my home. She just brought joy to my life, and I vowed that I would become a Reach to Recovery volunteer myself. I did that for 12 years. I moved to Valencia, California, and continued my work and saw that these women that I went to visit had to drive 70 miles round trip to a support group because there were no support groups there. I contacted the local hospital and asked them if they would give me a room where we could have meetings. The Cancer Society office in San Fernando Valley gave me their blessing. We started the group with 5 people, and 6 years later, we had about 30 people at every meeting. And as of this week, it still exists. 20 years later, it still exists. And they meet the second Tuesday of every month. So I'm very proud of that. And then I was diagnosed with chronic lymphocytic leukemia in 1998, for which there is no cure. And I have been on a clinical trial for that for 12 years now. So now I am an advocate for the American Cancer Society Cancer Action Network, an organization that I am so passionate about and proud. I serve as a state lead ambassador for the state of Nevada, and we are here today, about 500 of us, marching the halls of Congress, fighting for cancer research, asking our lawmakers to make it a national priority, and to not cut funding, and to keep the CDC programs, because it is vital. We have to just keep fighting it. I ask you to go to acscan.org and become a member. Thank you.
Good afternoon. My name is Peggy Belanger, and I'm from Southern Maine. I have a bachelor's of nursing and have been a nurse for almost 40 years now. And most of my profession has been working with patients and families diagnosed with cancer. My roles have been early detection and prevention programs, in screening, in promoting, and also in detection. There's so much I want to say, and I'm quite overwhelmed at all of you here, and feel very honored to be present, and I want to thank the American Cancer Society Community Action Network for nominating me. What I want to say today is, as a nurse, as a patient navigator, working with women who are diagnosed, it is an unbelievable experience for me to be part of their journey. And I want you to know that we, as nurses, are here for you every single day and want you to know that we support you. I am also, as a cancer care coordinator for Southern Maine Medical Center, which is a small community hospital in Maine, I work with patients from time of diagnosis through end-of-life care. And my passion is that families no longer find themselves losing a family member, someone who they care for and love dearly. And it is only through advocacy, through education and awareness, through supportive research and funding that we can make this change. Thank you.
Thank you. My name is Thelma Jones, and I'm from the nation's capital. As a 4-year breast cancer survivor with a rare form of breast cancer, I share the sentiments, the aspirations, and the hopes that all of my fellow champions have stated here. I am here in the capacity as an ambassador for the American Cancer Society and an advocate for the American Cancer Society Cancer Action Network. As many of my fellow champions have said, it is so important that we increase the funding for cancer research. There are so many breakthroughs that are coming, and without that increase, we may not have the breakthroughs to cure metastatic breast cancer or to cure some of the other kinds of cancers that exist in our society. But from breast cancer, which is what I have, it's rare because in this country, when 95% of the women develop breast cancers, doctors know the origin. I am one of that 5% that we were unable to identify the origin, and so it has a high risk of reoccurrence. It is also, I was diagnosed with large tumors, like about the size of a silver dollar. This is part of my passion, doing the volunteer work with the American Cancer Society and with this lobby arm, the American Cancer Society Cancer Action Network, a passion of volunteerism that is a family value of mine. That's why I bring this from something that my parents imparted to me. But in addition to the work as with ACS, CAN, and the American Cancer Society, who graciously nominated me for this award, I look at our challenge from a global issue. I spent more than 33 years at the World Bank, and so cancer here in the US, where we have every 13 minutes a woman dying of cancer, is also something that's happening globally. And as we know, what happens here affects others. So we do have to work to make sure cancer funding is increased and sustained. But more importantly, I serve as a community navigator for Smith Center for Healing and the Arts. And like some of my colleagues here, I work in a disadvantaged community. It's called East of the River, where the statistics there are alarming. And so on a daily basis or regular basis, I worked with 18 to 20 women. My goal by the end of the year is to have this work with 25, so that when I am walking in the East of the River community, they are telling me, I've gotten my mammogram and it's fine. And I've told my mothers, my sisters, and my colleagues, because early detection is what will help to reduce breast cancer incidence in our society. Thank you.
So thanks again to all our champions. A few folks snuck in with the champions here. We're really lucky today to have Dr. Sheila Pritterville from the National Cancer Institute, Myra Alvarez, who's the Director of Health Policy at the Office of Health Reform at HHS, and then we have the First Lady's Chief of Staff, who was also formerly the Director of Public Engagement and my old boss, Tina Chen. So we're really lucky to have them here today, and we just want to open it up for a conversation with you all, and I'm just going to hand it over to Tina.
Thank you, Kyle. And thank you all for being here, and thank you especially to our Champions of Change for everything that you do every day in your communities and for being here. And I have a special hello to my old dear friend from Chicago, Anne Marie Murphy. So, in addition to being formally at the Office of Public Engagement and now with the First Lady's office as her Chief of Staff, I was and I still remain the Executive Director of the White House Council on Women and Girls. And it's with that particular hat on that I think it's my pleasure to really be with you all here today. And I'm just going to say a couple remarks by way of opening. I have to sort of give a particular acknowledgement to the organizations that have brought you here today, because NBCC, Susan G. Komen, and American Cancer were three of the most stalwart supporters of ours in the first 2 years of this administration, as we really worked very hard for the passage of the Affordable Care Act. And breast cancer and breast cancer survivors and all of you who are warriors against this disease were a key part of that. I mean, I remember in particular an event we had with the First Lady in the First Lady's Garden in October of 2009 to really highlight the particular struggles that people with breast cancer had under our insurance system. Things like getting your insurance rescinded after you got breast cancer. Things like not being able to get health insurance once you've had breast cancer. Things like not having mammograms covered, and heartbreaking stories from survivors who really shared their particular. I remember so strikingly one woman who came and stood with the First Lady and told her story and talked about how she had caught her breast cancer in the first go-around by a mammogram and detection, but now that she had it, she could no longer get health insurance other than as an astronomical premium cost. And I will never forget her words. It has stayed with me for the last year and a half. She had made the choice between having a roof over her family's head and her health to get health insurance, to get those mammograms that she needed to save her life, and she had chosen to keep a roof over her family's head. And that is a choice I'm really so proud of this administration to say that women will no longer have to face in this country when the Affordable Care Act is fully implemented in 2014. And we only have that, and we will only keep that, I should say. We only have that, and we will only keep that because of all of your efforts and because of the grassroots efforts that you have, and all of you who have firsthand experience of what it means, to need that kind of health insurance and health care, and things like prevention services that mean mammograms are covered with no copays, all of the things that we now will have under the Affordable Care Act. You can speak most powerfully to that, and we only have the Affordable Care Act, and we will only keep it because of your efforts. So I salute you all and thank you all for that. So with that, I don't know if Myra and Sheila want to say something real quickly by way of introduction, and then we really want to hear from all of you. That's the purpose of today, is to celebrate your accomplishments and learn from you and hear from you, and if you have questions of us, to answer those. So, Myra?
So just really quickly, I'm honored to even share the stage with you all. While I don't have as personal a connection to breast cancer, I am a daughter, and I'm a sister, and I'm a friend, and like all of you, I want my loved ones to be and to stay healthy and have an opportunity to live a healthy life. So I have the great privilege of working at the Office of Health Reform at the Department of Health and Human Services, and our office is tasked with coordinating implementation of the law and working with all of you and working with our colleagues in the White House and in Congress to make sure that implementation is successful moving forward, so that the communities that need to hear the message the most are kept aware of the different policies and the programs and the benefits that they have access to. And it's really personal when it comes to healthcare, when it comes to good health. It's personal for all of us because it's our own families we're talking about. And Tina touched on the subject, but I think of my own mom. It's a tough economy out there. Groceries are expensive, gas is expensive, her rent is expensive, and she works hard to make ends meet. But I have a little sister who was a senior in high school. She's a very expensive senior. There's, senior prom and winter formal and college field trips. If my mom had to choose between paying her $30 copay for her mammogram or giving my sister $30 to go to UCSD on a site visit, there's not a doubt in my mind the decision my mom would make. She'd put my little sister first. And that story is repeated in every American family in this country. Removing that financial barrier is telling my mom, telling every woman across the country that the healthy choice is the easy and the affordable choice. And that's a reality that the Affordable Care Act's giving to all Americans, and I'm privileged to be able to work on that law and ensuring that it's implemented correctly and successfully so that more Americans have access to the quality health care services they deserve.
Good afternoon. Again, I'm very honored to be here, both on a professional and really on a personal level as well. Professionally, I'm a medical oncologist where I work with all my colleagues at the National Cancer Institute to really coordinate cancer clinical trial research across the country. On a personal level, I'm honored to be here to actually share and hear, but thank you, Champions of Change. I do come from a family of breast cancer and have seen my mother and grandmother die of it as a young child. Grew up and wanted to go into medicine, for those very reasons. And most recently, last year, my younger sister was diagnosed with breast cancer. But due to many, many of the changes all of your organizations have done over the years, we have had advances in science, but a lot of your advocacy made the experience for my younger sister night and day, treatment options, screening options, and finding things at a younger age. And I hope that by the time my daughter, who's now 12, is an adult, this will be much further along and cured. So again, thank you, all you Champions Change, to be here, and I'm honored to be here both professionally and personally.
Thank you. Well, to open us up, I thought I'd ask one question that might be, really useful for us to hear in the government, but to all your colleagues here in the room. And that is sort of what best practice or experience you have that you'd like to share with everyone here that has really, would save your colleagues time or really advance the issue forward, something that, has really been effective in your work that might be something that all of us can use.
Is this on? If I can just comment, maybe hopefully related to the question, as someone who does a lot of advocacy in the research area, through the work I do with the National Breast Cancer Coalition, what is important is that educated advocates are involved in the decisions on research and the priorities and what gets funded, what is the priority and outcomes for that. So I would say from a practice, the very precise education of energized advocates involved in the research process. And the other priority, if we look at, from a National Breast Cancer Coalition, both good research, educated advocates, but access to care. So no matter what we do with research and developing new treatments, if people do not have access to that, we cannot address the problem with the disease. So the work with the CARE Act that we have spoken to putting those three together. As NBCC and as we have looked at where we are with this disease, I think although we can congratulate each other on the very good work all of us are doing, it's not good enough. The status quo is not acceptable. In 1975, 1 in 11 women was diagnosed with breast cancer. Today it's 1 in 8. We don't know what causes it, how to prevent it, or how to cure it. Metastatic disease is in the back of everyone's mind who's been diagnosed with this disease, that it could come at any time, whether it's 10 years, 20 years, 30 years later, and that's what will end our lives early. So from a National Breast Cancer Coalition, we are really trying to change the conversation about this disease. What are we doing to understand how to prevent it, and what are we, primary prevention, and what are we doing to prevent metastasis from ending our lives early? Because no matter what else we do, the problem is increasing, and it's increasing almost exponentially globally. So that, hopefully that's some comments related, but it really makes it, we do need people to have access to the care we have currently developed. Otherwise, even the investments in research aren't meaningful because people can't take advantage of it.
And I'd like to, I'm sorry, add as a community navigator with Smith Center for Healing and the Arts, that it's important that we reach people where they are. African Americans is the targeted population that I'm working with. Thanks to a grant from the Susan G. Komen for the Cure, our community navigation program is specifically working with African Americans, and we're out in the community. I'm headquartered at Union Temple Baptist Church, which is a very popular, large African American church in the city. And as we know, socially, African Americans have a huge connection with churches. So if they are not coming in centers and hospitals for screening, we have to go where they are, whether it's at beauty salons that we frequent or whatever mechanism it is. And we also have to look at more from the hospital training standpoint to make sure their training is much more culturally sensitive, and that our hospitals or our medical universities are training more African Americans or people who look like us and understand the culture. Thank you.
And so I want to say that in many of the things that I've seen and heard over the last 17 years of my survivorship, the one thing that always seems to come to pass is that we really have to focus our resources. We spend a lot of resources on breast cancer, and it's really important that we have a group of interdisciplinary specialists that come together and really talk about the best possible way to end this disease. And the National Breast Cancer Coalition has really worked hard to define a strategy on how to accomplish that deadline 2020. And it's important that everybody become a stakeholder in that deadline 2020. We really work hard to hold everyone accountable for ending this disease. We have known amazing champions over the year, Pat Barr being one of them, Carolina Hinestrosa, amazing women, Randy Rosenberg, one of the founding members of the Young Survival Coalition. They stay with me. And I have to tell you that while I celebrate where we've come to now, I acknowledge we're all fabulous champions. There's a part of me inside that doesn't feel like a champion. I don't feel like a champion until we end this disease. And then I will celebrate. Not a moment sooner.
You asked the question about best practices, and I guess from my vantage point of serving on panel reviews as a consumer and also with a particular interest in metastatic disease, I would like to see more incentives for scientists to collaborate from different fields. I think some organizations are trying to accomplish this, but I think more can be done, where instead of a particular institution trying to study one aspect and keeping close to their vest, what's going on, that we encourage collaboration among cancer institutions, universities, pharmaceuticals, so that we bring together not only biologists as we think about cancer, but also chemists and physicists and statisticians. I just think there's much greater hope that we will discover, for example, the causes of metastasis if we can look at it from a variety of ways.
I think talking about best practices, one of the things that we think is very important in our Komen affiliate in Colorado, we cover 19 counties, and those counties are urban, they're rural, they're mountainous. We have barriers not only of geography but of language, in addition to economic and access. And I think what we've decided this year, the combined Colorado affiliates put about $5 million into our communities through community grants. But it wasn't up to us to decide where the money should go. We really convened about 5 or 6 community coalitions, and we brought together not only our BSEP providers, we brought together community agencies, we brought together people working in communities to really facilitate them deciding what are the priorities and how can we reach the uninsured and the underinsured women in their communities, because we don't have enough money to go around. We had some significant cuts in our Medicaid funding, so it meant that about 5,000 women would not have access to screening. So we're trying to work smarter with the resources that we have, but we're really trying to do that at the grassroots level and almost have, a double focus. So while we support research through Komen National into translational research, we want to make sure, because we know screening works, that women have access, regardless of what the barriers may be.
I wanted to support that statement, and it's really important that we don't let our guard down in terms of outreach and education. We've done a great job. We're reducing the fear out there in the community, but we still have some segments that haven't been reached, and so we can't get complacent. So whatever we do, part of the Affordable Health Care Act should also include outreach and education. Please don't think that we've done our job yet. We still have a lot more to do.
Yeah, I wanted to say, we have a lot of outreach going on. It's great, it's fabulous. It relies on a premise that every mammogram be created equal. And we do have a best practice in the Mammography Quality Standards Act, but last week I was in DC at the AACR Health Disparities meeting, and there was a very interesting poster I saw whereby this particular University of Illinois researcher was looking at women who were diagnosed with cancer and their prior mammograms. And the expert was looking for how many of those you could see evidence of them having had their breast cancer in the prior mammogram when it was potentially missed. And they looked at different correlates, and it showed that you were more likely to have your cancer potentially missed if you were poor, if you didn't have health insurance. It was very interesting, and it definitely implied that there are differences in the quality of mammograms. Now, when we all go for our mammogram, we certainly assume that we're all going to get the highest quality mammogram that exists. I think it may be time to revisit the metrics in the Mammography Quality Standard Act. Are they really measuring cancer detection rates for screening mammograms? Are we really truly looking to see are cancers found? Are they found when they're small? Are they found when they're early stage? And are they treated promptly? I think that's key, because we can do a lot of outreach and we can develop a lot of new technology, but if you can't access it or the quality is uneven, then the promise is not realized.
I just wanted to make a comment. I think there are 2 major focuses that we need to really fund over the next several years, both the great organizations that have nominated all of us as well as the great U.S. government. And one of them is pushing the envelope with regard to cancer research. We are really at a place where it's taking off. We're at the very beginning, and with the exciting changes in molecular biology and things that we're discovering new targets. I mean, look at the Herceptin story. We're not even, so many more women are doing so much better to huge success, not that we don't have a lot more room to go for improvements. So I think that's a huge place that we need to continue to focus, and we want to encourage people, if it's the right thing for them, to participate in clinical trials when they come down the pike, so we can continue to move forward in that. The second big focus speaks to what a lot of people here focus on, and that's actualizing what we've already developed. That's getting women to really understand how important, if they have a hormone-sensitive cancer, it is to take your tamoxifen or take your aromatase inhibitor, and helping them to take it to support them through the treatments. I've seen evidence that if all the women who had hormone-sensitive tumors actually took their full 5 years of these medications, the mortality rates would drop substantially. That doesn't mean it's anybody's fault. It's more we need to support our community, our women, our patients to be able to tolerate these medicines or develop ones that are more tolerable. So I think it's twofold, the issues. And obviously, the second issue has a lot to do with access, getting people in and getting the right care for them.
I just want to say, to add to all of this, a lot of it sounds very complicated to a simple person that's out there, that when they get cancer and they hear they're getting cancer, you know, that's the first thing they hear. Their first thing is fear. So there's so much they don't understand, so much they can't get their hands on because they don't know how. We, I think, have all been very fortunate where we have been associated with one organization, some of you 2, 3, 4, 5 organizations. A lot of people out there, they aren't connected to anything. They don't know where to go. They don't know who to talk to. They don't have any idea what the doctors are saying to them, because as soon as they say they have cancer, they're frozen. And somebody that's with them might not understand all that's available. So I guess I would say add for, you know, simplistic education and get it out there, and get it out there quickly, so that we can start that preventative thing, so that hopefully we won't have to go through all of this as much as we are now, because the research we want to go on, obviously. We need to get to the people, though, that are getting this day by day by day, so they know what to do with it immediately, and get to the more complicated.
Well, I think that's an important point, and several of you have raised that issue of outreach and education, and it's something we here face, you know, every day, you know, very specifically to the Affordable Care Act on lots of other issues as well. But I know it's something Myra is struggling with every day over at HHS as we implement ACA. You know, how do we get that information out? And I'm just wondering, for those of you, because you are active in this field, you are working with patients and survivors, what are there specific things that you have found that are effective or more effective at really getting that message out? And I know you talked about really having things. I think it's important, your point about being in your church, you know, being in the community and of the community. I think that's an important one. Are there other things? Is there new media ways? Are there messaging things that you all have found that would be, I think, really helpful to us?
I think you mentioned something earlier when you talked about the people that you met at the White House and they told their story. I don't think if we think about the Bible and how stories are the method of teaching in that, as well as other religions, stories are very powerful. I don't think the public understands the insurance issues. I have to say, with my advanced degrees, I did not understand lifetime limits. Truthfully, I mean, because I never worried about that. And I think that whoever is designing, you know, educational material, they do need to make it simple, but someone needs to tell a story with that, how that affects them. No one has a conception of what cancer treatments cost. And if there's one thing that I believe that we need to work on, is we need to bring in the discussion of how could we get a control, some control. I know that's not a good word in this environment, but how could we get our hands around the costs of treatment where they just aren't going up and up all the time? I know all the research costs and all that. So I guess what I'm saying, as a former teacher and high school principal, yes, education, very important. Keep it simple. Accompany it with a story, deliver the message where the people are, and get ahead of the media, because oftentimes I don't think the media, I know the media doesn't, oh, I'm sorry if you're out there. I don't always think that the media delivers the story correctly, and it's oftentimes just because they haven't walked it. I mean, when you hear someone famous who suddenly got cancer, they're telling a story, and I'm sitting at home and say, I could have said that, but no one's going to listen to Shirley. I mean, but if it's someone else out there, so use the administration's friends to get the word out. I'd love to sit with, people like President Clinton, whose mother had cancer, and he could tell a great story. And there's all types of people in the movie industry who've lost mothers to breast cancer. I know people would listen. After they looked them over, they would listen.
I just wanted to add something I'd like to actually hear more about. In addition to how do we get out the message about what works already, in addition, patients and our clinical trial system are really a cornerstone of making advances. And one of the things that we don't do so well is actually getting clinical trials out into some of the underserved and minority communities. So any thoughts and best practices, I know some of you actually work in those areas. We would love to hear things along those lines as well.
I want to say, because as we look at research, because I am so pleased that the American Cancer Society is really championing that, and it's from a biological, molecular standpoint and all of that. And sometimes I think some of our research should be going more into physiological, psychological kind of things, because there is a huge, huge element of fear that I feel that society does not understand and embrace when it comes to cancer. I am finding that one of the reasons women are not going to seek treatment or to be screened is because it's fear of the unknown. And this is not, I am not just seeing this in my work as a community navigator with Smith Center. Remember earlier I said I worked at the World Bank. I spent 33 years there, and I am actively involved with the World Bank IMF breast cancer support group, and these are highly intelligent, well-read women, but some of them have fear also. So even if we have all other things equal, if we haven't reached that first element to get them there, we're still beating our heads against the wall.
I'd just like to add that you wanted to know about getting the message out. I think it really helps to not only tell the story, but to have that story come from a survivor, because we understand what they're feeling. We're understanding the fear they have because we've all had it, so we can share that. It is important for us as survivors and as advocates to be educated, because there are a lot of things that come out in the media that are just wrong. We see them on Facebook, we get calls from our friends, and that's very important. But I think it's also important to remember the Shiras. I won't forget you. And the people that have lost loved ones, and to remember that we have a responsibility to them. I want to say to her, we have something for you so that you will not get breast cancer. That's what I want to say. I have a friend who passed away 2 months before I was diagnosed. Her daughter's growing up without a mother. I can't forget that. So I am trying to work really hard with the National Breast Cancer Coalition on their deadline 2020 to stop this disease. We need to do more and get that message out.
To answer your question, we need as healthcare providers to work more closely together, and especially with cuts in funding and the difficulty in getting insurance reimbursements and so forth. It's difficult for hospitals everywhere, and so positions are being cut. What we need to do is to put all of our resources together, work together, get the word out, form training programs, educate our communities, and stop fighting and work as a community. And we can make a difference. And I know at Southern Maine Medical Center, we started a focus group, and we listened to what women diagnosed with breast cancer needed and wanted from us. And it's made a huge difference in how we deliver our care. And I believe that that's what we need to do more of.
And I'm going to go into research, and I'm going to carry that theme forward, because the concept of collaboration, of changing the conversation so that we're all working together and not secretly in our own silos, is so key. I will give you, I wish I could remember the numbers, because I gave a speech on this, about the number of studies that have been done. Something like 33,000 studies have done in 1 year. And yet I spoke to the head of a very large pharma company, and this is something we all need to know. He said that in his job he needs to look at all the research and begin to learn, decide which is promising enough to throw out the billions of dollars to follow it through. He said 90% of the studies were not reproducible. In other words, all this research is out there. And he said sometimes he'd call the researcher, and this is a big pharma company. They'd call up and the researcher wouldn't talk to them. Or one finally talked to him and said, oh yeah, I had trouble reproducing it too, but when I finally got it, I published it. And that's really important, and I don't want to lose it. There's a lot of access, but we all have to be a lot smarter in how we're using these diminishing dollars. That's the reality of this world today. And we need to be able to pull together, collaborate, publish all research, what fails as well as what succeeds. And maybe then we'll begin to get a little bit more for our money.
I'd like to just mention, when you were talking about outreach, Chicago has, sadly, in Medicare, the lowest screening mammography rate in the country. And in fact, for African American women, it's even lower than the already very low Medicare screening rate, which is about 50.1%. I think that people react to messages when the messenger is familiar and respected, which is why I would be very eager if the First Grandma would do some PSAs in Chicago, because we really need them. Or any of the other First Anybody's doing some Chicago's PSAs.
If I can just respond to the question on the clinical trials, because I do some work in that area, and as you know, it's a very complex issue. There's no easy answers. But, it does get down to that engagement between the provider, the physician, and the patient. But many times the process is quite accelerated in the way healthcare is done today. So you have surgical intervention, or you have some sort of diagnosis, and then you have an appointment and you start your chemotherapy. And to give patients, to be respectful to patients, to give them time to understand treatment options, help them participate in that decision as an informed decision maker, much of the system and process doesn't enable that. It kind of takes away from it. And the materials we do not have, and I work a lot in phase 3 clinical trials through the NCI and sit on the central IRB. We have current efforts going on through HHS to make some changes in the common rule to try to simplify the consents but yet meet requirements. I think that is very, very important, reduce some of the delays, but we do not have any standardized way or standards to say we need patient interpretable materials prepared for every trial in a consistent manner, and not that you substitute in a legal informed consent process, and that those that are culturally sensitive, at least that there is some level of standardization there. And we also don't have good methods to compare it to standard, what you call standard of care. If a provider is going to do that, they have to reinvent the wheel. So how do you help someone make that decision, which may be the best care for them is to participate in a trial, because there's no tool sets, back to education and support. So that's kind of I guess I've talked too long, and that was a passion for me. I've worked on IRBs and reviewed this stuff since 2004, and people do the best job they can, and it's improved, but yet it's just kind of a fractured process without the level of standards and documentation that I think could help everyone in that process.
Just in terms of sort of the message getting out there and collaboration, I think one of the things that might be really helpful is that when we do put a message out there, that it's clear and concise and that it doesn't take us backwards. Like, for instance, when we put out all the information for recommendations for new screening guidelines, it didn't help our cause at all. So I just had to go public in saying that, because not that we've been dancing around it, but I think it's the ultimate collaboration, partnership, communication, reaching consensus, and wanting to do the best for the most number of people by by appropriate messaging.
Tying all this together in the discussion about the NIH, and what comes to mind when it talks about clinical trials is there's a couple of things: fear, okay, and then you're talking about making it simplistic. When I was diagnosed initially, of course, you start kind of that rat in a maze phase where you're just going to do pretty much whatever your doctor's going to tell you. I really didn't know at that point about the rights that I had as a patient. I didn't really understand as clearly at that moment that this was my journey. And when I metastasized, that's when I really began. I mean, I keep this ribbon on my car. It's a gigantic ribbon that covers the whole side of my car, and on the wheel says "Hope Always." And I wanted to remind myself that every time I got in my car, I wanted to know that I have incurable faith and incurable hope. But the point was that that's the point that I took control. But I really didn't know where to go to talk about with clinical trials. I really didn't know. I could go on a website and be totally confused. But I also found that my providers, my nurses, and not just my doctors, but even my nurses weren't that informed. And so there's a piece now that I really try to language this the best I can. In this journey, we have a right to have a quality of life as we move through metastasis, not just, or even at the initial point of diagnosis. And that's why, again, I really am just underscoring what's been said, is that we really need to be able to simplify the choices that are out there. We need to be able to take away the fear, because really what happens at the point of diagnosis right now, even despite all the wonderful work that our organizations are doing, there are too many women that get diagnosed and just give over their life because they think that someone else has the answer. And it really does come back. I'm just passionate in trying to underscore what's been said. We really need to actually simplify this so that women know that they have a choice and that they can have quality of life.
So, and I'd like to say that it is, while it is important to simplify, you can't really communicate about breast cancer in a simple way. I mean, breast cancer is many different diseases. It isn't just one disease. Yes, we've come a long way, but the fact still remains that there's still the same incidence of stage 3 and 4 cancers as there was 20 years ago. So we haven't made an impact there. We're still seeing the same amount of incidence. And those are the women, those are the cancers that people have the longer rates of living with metastases with, and those are the women that die. And so, you know, early detection saves lives is not clearly the answer for the women who are going to be diagnosed with stage 3 and 4 cancers. And it's very difficult for those women to hear early detection saves lives because they do blame themselves. And that's unacceptable. It is unacceptable that women have to die of this disease. And the only way we're going to get there is if we really all work together as a community to focus our resources and encourage everybody to really work together and, you know, interdisciplinary collaboration.
I just want to say really quickly, I think the respect of a patient from the very on-go, from the very get-go with a doctor, to respect that you are the one fighting this disease, you are the one being told that you had cancer, you are the one that lives with this from that moment till the rest of your life, whether you think about it constantly or you think about it every now and then. So I went in, my choices were a little bit different than some people's. I chose natural every time. I have also been very, very fortunate. Mine might have been caught early because of early detection, because of the preventative. And because God's just let me stay for this, I will say. I have many friends that have made other choices and had the same journey I had with the same outcome, or their outcome has not been so great. But from the beginning of time, when we talked to the doctor, I know I had to tell a doctor at one point, look, it's my body, and this is me. Don't look down at me because I'm making this choice, and do not tell me I'm going to die because this is the choice I'm making. That is, and I think every single person here can say, when we make these choices, because we want all the choices that we can have. We know our bodies better than anybody else. And yes, we're taking a chance no matter what no matter what choice we make. It is the most agonizing decision that anybody will make. I don't care what decision you make. It is agonizing to go through that. And once you get through that and you decide which way you want to go, you have to go with it 100%. But they have to have that respect for you and let you open yourself up to get that education. We can't be ignorant when we're deciding whether we want to live or die and what we're going to do with our bodies. So that's why I'm saying, for me, I want to give hope to other people. I want them to be strong enough when they get past that fear a little bit that they can go and they can open their doors, they know where to go, and it can help build up that courage instead of magnify and amplify that fear that is there. So just understand it's a very hard position to be in. Not that hard things don't happen to everybody. We're not different that way. It happens to everybody. This is what we've been dealt. But respect us and respect the patient when they come in and give them the choices.
Thank you. So we're about out of time. I want to make sure there are a couple of you who haven't had a chance to speak yet. You don't have to, but if you do and you want an opportunity, I want to make sure that we don't end the panel without a couple of you who have not said anything to have a chance.
Comment with regards to clinical trials. Part of it is a woman, when she's first told she has cancer, it's usually a primary care physician that has identified, and they don't have a lot of information about what are the next steps. So I think the early education and reaching out to them, and also to educate ahead of time. The worst time you want to hear about a clinical trial is when you've received a diagnosis about cancer. So we need early education and to begin demystifying what we mean by clinical trials.
One last?
There's
Our
one.
last comment.
There's one more issue that I don't think anyone has brought up, and again, being in healthcare, it concerns me, and that is drug shortages. So I think we need some help from you on that, because as I've been visiting hospitals, I've been talking with pharmacists, I've been talking with physicians, and they're extremely concerned about shortages, particularly in the area of chemotherapy drugs. And I know if it's me, because it could be tomorrow, or my sister or my mother, I would want to know that the physicians and the people who are educated about breast cancer are making a decision about my treatment based on my condition, my tumor, and what is best for me, rather than what they can get from a pharmaceutical company. And I think it's just the tip of the iceberg, and providers are extremely concerned. So any help with the FDA?
Well, that is a very good point, and I'm glad that you brought that to us, and you've got the right people here. I just want to, again, in conclusion, thank you all for being here with us, for sharing with us your stories and your wisdom and knowledge. I hope that this is the first of many, many conversations. We are here, OPE is here, to be that connection for you to the administration. It's something we want your involvement in, and all of your colleagues at the grassroots level as well. So again, we very much, salute you and thank you for everything that you do every day. And I want to communicate on behalf of the President and the First Lady, our great admiration for you, for each and every one of you, and the work that you do, and the strength and the inspiration that you give to all of us. So thank you very much.
Just want to say one more quick thanks to Shira Sternberg, who really organized a lot of this and put it together. And thanks to Tina and Myra and Dr. Prudhoe for doing this, and of course, thanks to all our champions. The one thing I will say, and a couple of you touched on it a little bit, about the message getting out and the message not getting out. And we want all of you here today and all of you champions to make sure you're using this platform and you're using your opportunity here today as a chance to get the message out about this fight. So thank you all for being here today. Don't hesitate to talk about this when you go home. Tell your friends, blog about it, write about it, put it on your Facebook wall. We love it all. But really, thank you to all our champions. We really appreciate you being here.